All right, Dr. Arvinder Soin also on the phone line with us, and those of you who regularly watch ET Now would know that he's been one of the medical experts who's been speaking to us consistently through it. Dr. Soin, this is what is called putting your money where your mouth is, in a sense. You have taken the vaccine, you've shared those pictures with us as well. We're showing them to our viewers. How does it feel?
I feel absolutely fine. In fact, I feel lucky and honored that I've been slotted to get the vaccine early. Just as a healthcare worker, we applied to get the vaccine and they just sent us names and slots. So I happened to be getting it today. So, it was painless, and I'm very excited that, I'm on my way to getting immunity against COVID over the next 6 weeks. Because I've got the first dose, and you've got to have the second dose of the same vaccine. And then 2 weeks after that, you're protected. But really, I must stress that COVID-appropriate behavior has to continue through the next 6 to 12 months or even more until a significant proportion of the population can be vaccinated. Because obviously you have to be protecting yourself, but also be socially responsible and make sure you don't spread the infection.
Dr. Soin, which vaccine did you receive? Was it Covishield? Was it Covaxin?
When I entered the vaccination center, I had no clue which vaccination I was going to get. I knew that those were the two, and the government and the DCGI have looked at the safety of both, and the effectiveness of both of them producing an immune response has been ascertained. So I was pretty open-minded and relaxed, but I happened to have got the Covishield vaccine.
Okay, you talked about us having to take precautions for another 6 months to 12 months, possibly even more, till a large number of people have received the vaccine. Are there any estimates that you can put to this large number of people, and by when this would happen? Will it help when the supply increases and vaccinations are available in the private market as well, so that we can bump up the scale of vaccination and achieve that end goal faster?
Absolutely. There are several things that are going to help eventually reach out to a large proportion of the population. And one of them is that the two vaccines that have been approved, their efficacy will be confirmed over the next 3 or 4 months by trial results and also by actual people getting vaccinated in the vaccination drive. So there'll be more confidence among people, and it'll then become universal vaccination without anybody hesitating or being afraid to get the vaccine. So that's the first thing. So that the reach of the current vaccines will increase. Then they will be ramping up of the production of these two vaccines. Then I'm sure another 3 or 4 vaccines will enter the fray, and they will become available in India over the next 3 to 6 months. And of course, those will then be produced or imported in large numbers. So I think all this will add to capacity over the next few months. And I would have thought, and this is a guess, nobody knows for sure, but I would have thought that if around 50 or 60% of the country gets vaccinated, then the sting will be out of the pandemic and slowly normalcy can return.
For a country our size, 50 to 60% is a lot, and a large, long way to go. Hopefully, over the next few months, we will have more vaccine candidates. We have 2 today, but we will have more. We will have a larger manufacturing facility. So there will be, more doses being pumped out. And let's not forget that the nasal vaccine on the horizon could possibly be a game changer. It'll be 1 dose, it'll be fast, it'll be quicker. So all of that is yet to come. But today has been a big start and a great day. And Dr. Soin, we're glad to have spoken to you today. The best of luck. Keep us posted on how you feel.
I feel absolutely fine. The procedure was painless, and it's been about an hour plus since I've had the vaccine. I feel no problems at all, and I'm getting on with my day, and I'm talking to you in between seeing patients, and I'm going to have some surgeries later in the day. So hopefully everything will be business as usual.